able to make it.
Good evening, everyone. Communication check.
Hello, Greg. We can hear you.
Greg.
All right.
And we can see you.
Perfect.
Roger.
Good evening,
Roger.
Sergeant Major. Smoke them if you got them.
Okay, you're live on YouTube now.
Okay, I'm going to wait one more minute and get us started.
Hello, everyone. This is Bill.
Hi, Bill. How are you?
Great. I might have to.
Yep.
You might have to.
Oh, I may have to sneak out a little early. I'm in the process of just starting to move, and someone's going to be texting me to come help me. So I will.
Don't turn that down.
No, I'm not. Yeah, I'm moving over to the old East Side School.
Oh, are you?
Really?
Yeah. So it's nice. So.
The pictures on Facebook of those apartments look quite nice.
Yeah, she did a nice job. They're not
Yeah, it looks like it.
They're not like super fancy, but they're well done and well laid out, and yeah, mine's comfy. So
Where do you live now?
where I've been on 10th.
Okay.
Yeah.
In a house?
Yeah.
Okay. So now you're moving into an apartment.
Yeah.
Somebody else mows the lawn.
Correct. Yeah. Well, they'll have a bigger yard, and we're going to do a garden over there. Abby was saying so.
Oh, nice. Does she live there too?
Yeah.
Oh, here we are
So-
talking on.
I know.
Sorry.
Here we are. Welcome, Chairman Bartlett. All right, I'm calling at 5:30 and welcome everybody. I'm going to call to order this regular monthly meeting of the Health and Human Services Board. And if we have members of the public watching our county YouTube channel, we're glad you're here. Welcome. We could let the record show without calling the roll that all the members are present, including Chairman Bartlett, with the exception of Sarah Schaefer, who I think her work schedule conflicts with our start time. She usually joins us later, so I will note that if she comes in, but we're okay with that for the record.
Sarah Schaefer is, I'll have to look, but her term is ending and she does not want to be reappointed.
Okay, and the term,
So-
Chairman Bartlett, her term expires this month in April, yeah?
Well, I have to look at that I can find out for you in just a little bit here,
Okay,
but it's soon.
Yeah, it is now. She was appointed in April. So
yeah, that
Okay.
makes sense for the appointments in April. Okay, well, that will be a loss, but we'll hopefully find someone else with a similar experience set. So we have minutes to approve from March 25th, 2021.
I move.
Supervisor Steen moves. Is there a second?
I'll second.
Supervisor Cromrie. Any discussion? Additions or corrections? No additions or corrections. All in favor of approving the minutes, please say aye.
Aye.
Any opposed? Minutes from March 25th are approved. Luann, do we have any public comment?
No, we do not.
All right, there
You-
is
You
no,
weren't made aware of any, Chris, were you? I didn't see any, no.
all right, thank you, Luann. So there is no public comment. Review of the next meeting date. If
oh,
you
jeepers.
carefully looked at your agenda, it said it was April 22nd, 2021, but that's not true. Actually, it is May 27th, 2021. That's sneaking us up into Memorial Day weekend. Does anybody have any problems with that date? Hearing none, we will assume the next meeting date is May 27th. And yes, Supervisor Steen.
I haven't checked with my social scheduler yet, but my grandson is getting married that weekend. So I may be leaving a little early. I might not be able to make that meeting.
Okay, all right. Anybody else feeling like they might have a schedule problem for Memorial Day weekend? Okay. All right. We will miss you if you can't join us. So May 27, 2021. And I am assuming, although we can confer in the month to come, I'm assuming that it will be on Zoom as well. And Katie can be the ultimate judge of how we gather. Okay. Greg Quinn is here. Thank you for joining. Veteran Service Office report, staff report. He's provided an excellent written report and a financial report. So this is all yours, Greg.
Okay, thank you. Good evening, everyone. I'll start with the kind of memorandum formatted document that I sent out that just kind of does a roll up of some of the main areas for the past month. So locally, kind of starting off, just give a little bit more of a synopsis of what that description is referencing. We're partnering with a number of organizations to finish up the process of moving the Veterans Eternal Flame Memorial from the previous building that the county owned here. We've made some progress on that, and I just list some additional funding that's come in. We now have a dedicated organization to manage the finances on that with the VFW 1039 here in Menominee, which I think is a good separation, so that donations will go there. They are nonprofits, so anything we receive, we'll be able to provide supporting documentation for that. And so moving from that, regarding state benefits, I'd read a little bit for the proposed budget, Governor Evers, and I just made a note in there that there's a recommendation for additional property tax credit for disabled veterans. Currently, as it stands, the state of Wisconsin does a property tax credit for 100% disabled veterans due to service or their surviving dependents that they're surviving dependents. There's some other parameters that go along with that, that if the military caused the death of that veteran. So we have I think probably 60 some that qualify in the state, or in Dunn County. And so there's a proposal to decrease that down to 70% disability to qualify for the property tax credit. And just kind of as a reference, if those that look at their income tax filing, if you look at your Wisconsin income tax filing, it's usually like page 2 or 3. There's a question on there about being a disabled veteran, and that's the spot that person can claim that that property tax credit to come back. And it's your home in 1 acre. It's not, the whole farm. So it would be a nice additional benefit, but it'll be comparable based upon the ratio of the 70% versus 100%. So it wouldn't receive their entire property tax credit back if it's approved. It'd only be 70% of that, or 80%, or 90%. So I see that as additional benefit. Again, more money that comes into our constituents' pockets, more money gets spent, and that's a good thing for the county. On the federal benefits, the current stimulus that was just approved, the VA is using some of those funds to waive medication co-payments for veterans. Previously, last April, they had just put like a deferment on those payments up through December of 2020, sent out the bills in January. There's a lot of sticker shock for some of our veterans. We received a lot of phone calls regarding that. So that was a nice use, I think, of the stimulus money to go ahead and cover those medication co-payments. And the medication co-payment costs for veterans using the VA for healthcare pretty minimal. It's $5 for generic, $8 for mid-tier, and $11 for name brand. So the other, as far as the office, we just completed 90 days into the fiscal year, so there's nothing significant regarding that I think are noteworthy to bring towards the human services for our current budget. Regarding emergency preparedness, COVID-19, we're business as usual. hand sanitizer, masks, appointments, still seeing people, and no contact tracing phone calls to our office. We're going to just keep doing business as usual. We did have one of our past volunteers that has come back to dedicate 3-4 hours a week. Just wanted to make sure that a little bit of the dust settled regarding the pandemic, and so he's now come back to help and assist us. He does a lot with our medical equipment in our office, so that'll put us roughly, we got 10 to 12 hours of volunteer time back, which is pretty helpful when it comes to answering phones, scheduling appointments, and taking medical equipment out the front door and receiving it. Any questions regarding this portion of my report?
Only question, Greg, is whether there are additional funds needed for the Veterans Eternal Flame.
A whole bunch. Direction given to me was no county monies going into it. But I would argue there's in-kind money because the county has placed the location of it. As you enter into the community services, we posted two little plastic locators out there that show this is going to be the future home of it. So, but the direction is to ensure no money goes into it.
So no county funds, but donations, I assume, are welcomed.
Yes, we're I would say probably a month away from doing any type of capital campaign on that. I'm going to be meeting with the service organizations to meet with a graphic designer. We were trying to get some free labor on that for the graphic design, the draw up. We have a penciled in drawing that thankfully Bob Colson has been working with us and helping with a lot of this, and so he did a really nice hand drawing, which has been passed off to graphic designers. So we'll when that happens, then we have heard of an expert within the Health and Human Services that knows how to do a GoFundMe page. So we might tap into some of those resources.
I wonder who that would be.
Yeah, stomp, and wink, wink. Making a phone call. So there'll be more information out about that. We've held off on really putting anything out there advertising wise because people and this is more my advice to the group I'm working with. People need to see what they're donating to and to know that the end outcome, and if we end up with excess funds, they need to know where those excess funds are going to go. And so those are some of those additional details, and I'll keep updating the Human Services Board on that.
Yeah, thank you very much.
Yeah. I'll move on to the our service, our veterans served report, and kind of with the direction again, I've included the full fiscal year 2020 comparison that you can reference to just see trends yourself to be able to analyze that. And you can, as you go down through that, I'll entertain any specific questions that anybody has, but overall, if you do a comparison to March, you can see there's a lot, I would say a lot more interaction or in comparison to last year, March. And if I was to do arm's length analysis of that, I would probably correlate that to the COVID pandemic. Not just back in March is when things really became publicized. So in 2020, I would, and compared to this year, March, we got the foot on the gas with helping people right now. So that would be my arm's length analysis of that. And as always, include impact statements. And I think once we get to the action items, you'll see that I gave you a page and a half of impact statements for my annual report, which is the roll up of 2020. I put, well, I'll start with number one. Just to kind of give reference of how long it can take if claims aren't done correctly, or if claims are not viewed correctly by the VA. There's a couple things that happen. The most impactful is the delay. So individuals have to wait, in this case, up to 5 years for this individual to get an approved claim. But I think in this instance, a huge benefit for this particular veteran. He had a busted up knee while he was in service, and unfortunately, it just took them a long time to finally look at the fact when they said he hurt it playing football in high school. And when I presented to the veterans law judge, I said, "Hey, you have his yearbook. He's not in any football pictures." And so those are just some of the little strategies and tactics that they have to err on the side of the veteran. So, but I'll also highlight the virtual aspect, and I think I've talked in previous reports that some of the positive outcomes of the pandemic has been the utilization of technology, kind of pushing those that are that haven't embraced it as much to use it to their advantage. And these are this particular veteran. He was in a parking lot down in Texas on his phone, connected to a Wi-Fi, doing this virtually with me connected in with a veterans law judge that was probably Washington, D.C. So you know, if we weren't able to do that, this veteran would still probably be lingering out there waiting for an in-person hearing with the law judge. So I just want to kind of emphasize that. So there's some positive things that have come from the pandemic, and this is going to be one of those things I think that'll stick with the VA. That'll make things better as we go forward. The second item, and I put it in capital, and for those that text, I'm not yelling that, you know. So it just
you were.
Okay. I wanted to emphasize the department collaboration. A lot of times I'm, you know, and even item number 3, the collaboration amongst our departments within the county, it really enhances the efficiency and that warm handoff for the folks here in Dunn County. And this just a particular interaction, veteran, couple bad decisions. I get emails of any self-identified service members or veterans by the or from the jail captain, and so I reached out and connected with this veteran, and it was really a quick, real-time $100 meeting for him to just come in and sit down and go through benefits, because he had went years without adding his spouse and children to his benefits. So it was like an immediate $100 a month impact. And a couple fines he's got to pay. So it was easy to sell. And so now we've got some more work we got to do. You know, we're able to bring him in and convince them there's more that can get done. And the last one was another interaction. Again, we had another service member called the crisis line, and the crisis coordinator here, thankfully, I had the veteran come in the next day. They send me the crisis report when they self-identify. She came over, we both sat down, talked with the veteran, got a plan. Everything's moving forward. He's going to be receiving some additional support from Chris's behavioral health staff. So those are those warm handoffs, that confidence that I think that gets instilled in what happens here, even given some of the challenges that we've had over the last year. Any questions regarding the items I just went over? All right. Yeah, then the financial items, as I'd already kind of indicate, nothing significant, but I do always include the printed out report out of the SAP, our accounting software for revenues as well as expenditures. If you have any specific questions about any of those cost centers, please ask. At this point, there's nothing significant that I have to report on that.
Are there any specific questions or general questions for veteran service? Hearing none. Thank you, Greg. Good report. Moving ahead. Oh, and let the record show, please, that Sarah Schaefer has joined us. Welcome, Sarah. Nice to see you. Moving ahead to the Department of Public Health. KT.
Hello, everybody. So I sent out a situation report for my reports today, last night. So hopefully you guys were able to read through that. Many of the same graphics, just as an update. Our cases have increased 6 over yesterday, so really consistent with what we're seeing from the last 7-day average, which is about 6 cases per day here in Dunn County. One of the things that I wanted to share is that also including the percent positivity, and that is a metric that many people use to indicate whether or not we have community spread or not. And so the state looks at that and publishes our percent positivity on a 7-day average every Wednesday. And it's one of the metrics that we use when we have conversations with Red Cedar Raceway. We want to make sure that we have a percent positivity by test of PCR test of less than 5%. So we have come down a little from last week, and we are at about 7.1% right now. So that's moving in the right direction, but we are still continuing to see some cases, and I'm grateful that we are seeing less cases per folks tested, so as a percentage. We are continuing to see, so the graphic that I included about activity, we are continuing to see significant activity in Minnesota, and our border counties are reflecting that. There is some speculation that because there is a significant amount of variance, both the UK variant and others in the Twin City Metro, MDH has done a better job genomic sequencing than State Lab of Hygiene they have better capacity rather. There is some speculation that we also are seeing some increase due to variants. We did have a breakthrough case. So you may have heard in the news that there were 5,800 identified breakthrough cases, meaning people were fully vaccinated and then also tested positive. So we had one of those in a cluster of illnesses in a regional school. One of the parents associated with the cluster is a healthcare provider and fully vaccinated. We have sent that sample off for genomic sequencing, but there is some concern that variants may play a role in breakthrough after vaccination. And then there is a little bit of information here about vaccinations here in Dunn County, as well as regionally. We are seeing a reduction in uptake of vaccinations. So part of that is that, well, there's a lot going on there and a lot to unpack. So we are taking a pause. We sent some vaccine back last week. We are not accepting vaccine next week for first doses. We'll continue to give all second doses because we want to regroup and really understand what the barriers are to getting vaccinated. So it may be that we have hit a segment of our population that's a hard no on vaccination. That could be part of it. But there is more likely a segment of our population that is looking for a more convenient vaccination or really wanting to have conversations with trusted individuals, people in their family that have gotten vaccinated, their provider. And so we're really going to spend next week with some qualitative data collection, key informant interviews, reaching into the public that we, business sector and faith community to understand what they're seeing and what their community has expressed to them. It's not in our 65 and older. What we're finding is that we have good uptake in our 65 and better, but really it's the demographic younger than that. So if you're 65 or better, you remember iron lungs, you remember what polio did, you understand the benefit that vaccines can provide. But really in that younger generation, the risk and benefit doesn't compute as much. And so there's still some work to be done to meeting people where they're at, getting everybody that wants a vaccine vaccinated, and really encouraging people to protect the people that can't be vaccinated. Our hospitalizations are actually reflecting our vaccination status. So our 2 hospitalized individuals are in their 40s. 1 is intubated. So it's good to see that our most vulnerable people are vaccinated and we're not having the same level of illness and infection in long-term care facilities and congregate living situations. But there's still work to do.
KT, would you perhaps briefly address the idea of bringing vaccination to some of our community partners, or call it non-traditional venues?
Yeah, so we live in a culture of convenience. We do things because it is convenient. And also many of us are really, really busy. If you're working 2 jobs and trying to get food on the table, healthcare is kind of a luxury and it's not super accessible. And so we are considering working with faith communities to do a pop-up clinic in front of churches. So people go every week. So it would be easy to catch them in 3 more weeks for a booster, or a grocery store, or a pantry, so that we can get folks that are there anyway, that want to be vaccinated, and to address that potential barrier of convenience or inconvenience, or barrier of just not having enough time in the day. So that's one of the things that we're looking at. We're also looking at, as a state, transitioning eventually to a model where it's like the flu shot. You go in, you get vaccinated through your provider, or you have a medical home and a relationship. I don't know that we're quite there. I still think we have work to do. But ongoing, that may be for that last 20% an opportunity. There is an opportunity for vaccination of younger people ahead of us. We expect Pfizer to submit an EUA, or emergency use authorization, for adolescents age 12 to 16 in the next week or 2, meaning that that could be available to parents that want to have their children vaccinated as early as sometime in May. And again, that's a population that we see is very effective at both getting and giving COVID. And we're seeing a lot of cases right now in that adolescent group.
KT, yesterday I had a meeting, and I guess, I know that there's all thoughts as far as the vaccine goes, but it kind of took me back. I was in this meeting and it was brought up, have you been vaccinated yet? And the school personnel all said, yes, we have. The parent, on the other hand, said, well, I'm waiting for all you guinea pigs to see what happens. And I honestly didn't know how to respond to that.
I think that there are challenges, and we want to make sure that we validate that people. This is a health decision, and it is important that people have their concerns addressed with trusted healthcare providers, or trusted people in their community, in their family. There is a large amount of people that want more data. They want it to be approved formally by the FDA, even though we've got 75 million doses worldwide have been administered, and the CDC has put out data longstanding about efficacy and safety in pregnancy for Pfizer and Moderna. There's a lot of data because a lot of people have had doses. I think the BLA, or the formal FDA, so biologic license agreement, BLA, so the formal FDA approval is really an issue of time. I don't see anything in the data that's there, and it is robust, that will prevent Pfizer or Moderna, which both have stated publicly that they will proceed with a BLA request so that they can achieve formal FDA approval. I don't see anything that's going to impede that. But yeah.
KT, in response to the interesting question that Bonnie just raised, you always send us documents with hyperlinks so that we can get more data. Is there a single data source that you would recommend that we could reference for people who have those kinds of guinea pig questions?
Well, I think it's going to need to be tailored to the individual. So many folks may have sources that they trust over others. And so it's going to take a little bit of digging. I always encourage people to go to the CDC, the WHO, some of those really trusted and peer-reviewed sources. But again, it takes a lot of meeting people where they're at. And some people don't want data. They want stories. They want to know that you had it and you had a little bit of a sore arm and a headache, and then you were exposed when your kid went to a baseball game and you didn't get it. You know, people want sometimes the stories behind it.
Other questions for KT on our COVID-19 situation or vaccinations? Chairman Bartlett.
I could bring up what I emailed you. I didn't think I'd be here at this meeting tonight.
No, please go ahead.
You know, as Jody brought to my attention, there's a number of comments on Facebook about racing shutting down. And of course, I'm sure the majority of them are negative. And I was thinking of my son that I've been trying to talk into getting vaccinated and is in his, I think he's 40 now. But if there, I don't know what, you know, I don't understand that the reason for getting vaccinated for him isn't enough to protect his family and to ensure that he might not end up in the hospital, but it just doesn't seem to be enough. And maybe if racing would help promote it, that, you know, if the more people that get vaccinated, the quicker they're going to get back to racing. It's a proven fact. And so it's just like you pointed out that in our hospitals, we don't have the older generation isn't in our hospitals because the majority of them have been vaccinated. So it does help. And I don't know if we could get racing as a group or maybe church groups. I tried to get that at our church when they were talking about going back, getting back into church. Well, we're at 25, but actually we're less than that because we have the teens usually. But I said, why don't we promote getting a vaccination? And if you've been vaccinated, come on in, I don't know, maybe we could get other groups to jump on the bandwagon and kind of promote getting vaccinated as another reason. I mean, I think there's enough reasons out there, but some people maybe one more reason might help them. And, I guess I'll throw my son as an example. He could just as well be a racer. He's a mechanic. He's into vehicles. He's into other recreation instead of racing. But I guess I could probably see that the majority of the racers are just like my son. They're in that age group. They probably don't feel that they need it as much as some of us other ones. And maybe this would give them another extra boost to get it. It's just a thought that maybe we could do that.
I appreciate that. And I have had conversations with Mark Thomas. We check in every Wednesday. And one of the things we talk through is that they're going to try to do their part with encouraging people to be vaccinated by having a specific raffle for folks that can prove that they were vaccinated. I'm very happy to meet them in any need that they have with a pop-up clinic if that's something that they feel would be received well by their clientele. And you're right. So some people, their reason for getting the vaccine is so that they don't have to be quarantined and miss football practice. We've seen those kids. It's a great reason to get vaccinated. Some people, they get vaccinated because they want to re-engage with their church community. It's a great reason. My kid was back at Stepping Stones volunteering yesterday. That's a great reason to be vaccinated. So whatever people's personal reasons are for vaccination, we want to promote that and find different levers to pull to encourage that decision. Thank you for the suggestion.
Yeah, Chairman Bartlett, I thought it was a interesting suggestion, and it opens up other possibilities for, sort of non-traditional places for people can get vaccinated.
But we have to thank Jody too, because if she wouldn't have brought my attention to that Facebook comments, I might not have thought about it. But after I saw that, I got to thinking about it. It's a good reason for them to do it.
And after I heard from you, so I thank you too, Jody. I read some of those comments, and there's hope for change. Other questions, Supervisor Bjork?
Very interesting that you brought that up with the racing group early on this year when we were being contacted by supporters of racing. I had said to them, I says, you need to do whatever you can to enhance your public image. And one of the things that you could do is, you could have every Quick Trip in Menominee or in the area have face masks that were red that says, I support Dunn County Racing. With the idea that the more you spread what you're supportive of, the more likely you'll be able to achieve your goals. And maybe it should be something to the vaccination if that's a thing. But I mean, they got money to spend. And anything that they could put out there, that's advertising space right on the front of your face. So it's just a thought, but I mean, I talked to them, this spring about exactly the same thing.
Thank you. Other questions or comments? I wanted to note, and I assume that everyone has looked at them, but I loved that in KT's situation report, there were a couple of really very nice thank you notes, which actually all of us should be cultivating. But a small way to acknowledge the really excellent and very hard work of the health department. I thought they were very sweet.
And you guys will see in our budget adjustment that there was also a little token of thank you. Absolutely not necessary. Vaccines are free. People should not be charged, but they were so happy with the service that they had that they wanted to give back to the COVID response here in Dunn County. And so they wrote a check for $100 to go back into our clinic operation. And that was really, really sweet.
Anything else from the committee or from KT? Are we ready to move on to finances? Sarah is with us.
Hi, everyone.
Hi, Sarah. Thank you. Yes, we can hear you.
All right. I don't know if I have the power to share my screen. I always struggle with this one. Oh, I can't.
Try again, Sarah. I just changed a setting for you.
Oh, thank you. Can you all see the 2020 end of year final for the health department? I'm going to start with that one. I have two sets of financials.
Yeah, you do. Yes, I can see it.
Okay. Thank you. This is end of the year 2020. So what I've done on the expenses here, it shows total expenses of $1,616,374.54. On the revenue page, it's $1,641,277.03. So when I do the total, it looks like the health department will give back $24,902.49 in revenue back to the general fund. These are still yet unaudited numbers. The audit is currently going on right now. So these are just numbers right now that we've taken from the system. These are non-adjusted entries, are not posted yet. Is there any questions on 2020? Okay, I'll slide over to, can you all now see March 2021? Okay, again, kind of the same concept. Year to date, there's $505,953.27 in expenses posted into the system, and there's $169,104.94 in revenue. So as of right now, that shows a deficit of $336,848. But to note that the revenue is 2 months behind due to state claiming the CARS report, where most of the health department's revenue comes from, is 2 months behind. So we probably only have about 1 month of revenue from the state posted. So, otherwise, I don't have a note for anything substantial to report on. Is there any questions?
Guess not.
Thank you.
All right. Thank you. Human Services, a staff report, and I haven't welcomed Dale, but thank you for being here. We're going to have, we talked about this in our legislative agenda, increased budget for Birth to 3. So we're going to now have a bit of an update on the Birth to 3 program. Chris, you want to make an introduction?
I will. So I believe that many of you have met Dale before, but Dale is the Deputy Director of the Dunn County Department of Human Services. In that capacity, I would call her kind of an operational administrator. She deals with all of our hiring. She deals with all of our IT and our equipment related things, but she also manages our administrative support staff, as well as the Birth to 3 program. And so she has been side by side with Chairman Bartlett and I and some others in a number of legislative meetings over the last few weeks, and it seemed like a good time to have her come in and do a little update on the Birth to 3 program, or a little overview of the Birth to 3 program, as well as a review of the funding ask in the biennial budget.
Welcome, Dale. Thank you.
Thank you. Good evening, everyone. Thanks for having me. I have met most of you before, but there are some new faces in the group, so good to meet all of you. Many of you have maybe heard my Birth to 3 spiel before, but perhaps some of you are not so familiar with the program. It is a federally mandated program authorized under the Federal Individuals with Disabilities Act, the IDEA Act. It is a program that serves exactly what the name implies, infants through age 3 that have a 25% delay in virtually any area: motor, physical, speech and language, cognition, social, emotional. And it is a team of clinical professionals that evaluate those children and make that determination about whether they're eligible for the program or not. The team consists of a service coordinator or case manager, special education teachers, physical therapists, occupational therapists, speech and language pathologist, and they work closely together to evaluate that child as a whole, not just in those individual areas, but really take a holistic look at that child. And the philosophy of the program is a parent coaching model, meaning that it's not a traditional a therapy appointment with these children. It really is an effort to coach and teach those parents to provide those services to that child throughout their daily routines. So they might come in once a week, but they might only come in once a month to that child's home and work intensely with that parent and demonstrate and model techniques to use with that child, again, to really hopefully enhance that parent's ability to use the techniques with the child in their daily routine, with bath time, with eating, with going to the grocery store, managing some behaviors. They might do some eating and feeding studies or evaluations and try to help parents with those kind of skills. So it is a very all comprehensive program and a very costly program, unfortunately, that is required. Every county is required to provide that programming, or it's federally mandated and the state assigns that to counties, but unfortunately very underfunded. Last year, the Birth of Three program, I think the total that I found was $621,889.41. And our allocation from the state or feds for that program is a little over 140,000. We do recoup some MA and private insurance benefits, but not nearly enough to cover the program. It is still a large percent of county levy that funds that program. To complicate matters, certainly COVID this past year has made that challenging. The program philosophy does require that those services are provided in the child's natural environment, primarily their home, but it can also be in a daycare setting or in a park or at the library. But with the pandemic, we all had to learn some new techniques, and I would echo what Greg said earlier about technology that did teach us to maybe think outside the box and use that to our advantage. And in some cases that can be effective, but those clinicians were very eager to get back in the home, and they did return to home visits in March of this year. And some of those services are just really difficult to provide through a computer screen. So they're happy to be back in the homes. They're being cautious and still wearing masks and still asking the families to wear masks, but they are once again trying to, or at least offer those services in person. Not all families are quite ready for that. Last year, when we went into the shutdown or the safer at home order in March, the state overall saw some drastic reductions in referrals and enrollments in the Birth to Three program. I just pulled a chart from the state website, and between March 16th and March 30th of last year, 2020, the enrollments went from 127 to 41. They just saw a drastic drop off, and it stayed kind of hovered in that really low, in those really low numbers through the summer. Dunn County saw some reduction. We certainly didn't have the referrals and enrollments as a typical year in 2020, but we didn't see anything near that kind of reduction. And I credit the dedication of the staff in that program. There are seasoned professionals. They have good relationships with the clinics in town, who are our main referral source. They have good rapport with the health department folks that might make referrals, and with their colleagues in child protection world that sometimes make those referrals. So we did not see the reductions like the state did overall. Our enrollment or our referrals, sorry, I was just going to check to see if it was, there are two, referrals might not always turn into an enrollment. Obviously, the children or the child is evaluated, and some children aren't found eligible. So that's not an exactly same number, but in 2019, as an example, we had 135 new referrals for the program through that calendar year. And in 2020, we had 109. So a slight reduction, but again, not nearly the drop off that the state overall saw. So again, credit the professionals on that team. They're dedicated and work really hard at providing those services to these young kids. The early intervention program is evidence-based. It really seeks to get these children up to age level. Some are able to move on from the birth to 3 program and not need services again. Of course, some of the kids have more significant long-term disabilities where they may always need some assistance or extra supports, but even so, the birth to 3 program, again, really promotes assisting those parents with learning techniques and strategies to deal with those disabilities in a more successful way. Any questions anyone has about the program?
Do you want to speak to the governor's
Oh,
budget?
of course. I'm sorry. Yes, there is a budget proposal for some additional funds to be added to the birth to 3 program, which we certainly would welcome. As I said, it's very underfunded. Just trying to find those numbers, sorry.
And the committee will remember, while Dale is looking, the committee will remember that in our legislative recommendations to the county legislative agenda, increased funding in the birth to 3 program was part of that.
So the dollar amounts for proposed for 2022 is 3.3 million and 6.6 million in 2023. However, the way it's written in the proposed or in the budget proposal is that it's tied with children suffering from lead poisoning. And as I understand it, in some counties, that is a really huge issue. But our ask to the legislators was that they remove that criteria, that it's specific for that, that one issue. Dunn County thankfully does not see many of our kiddos with lead poisoning specifically. So we would like to see that funding available for any child that might meet the eligibility criteria for birth to 3. And that was our ask at the meetings with the legislators in these recent Human Service Day at the Capitol. That was several days at the Capitol virtually.
Questions for Dale? Thank you. That was very helpful.
Thank you for having me.
A wonderful program. You're welcome anytime. Chris, do you have anything programmatically that you would like to highlight?
No, I think the only thing that I would do is piggyback on, and I mentioned it a bit earlier, Chairman Bartlett, Dale, Chris Kistner, our Economic Support Manager, Wendy Winger, Behavioral Health Services, Carrie Anderson, Family and Children's Services, in various ways, shapes, or forms. I think Dave and Dale and I hit almost all of them, if not all of them. Well, I hit them all because I was the Zoom host. But we met with the 8 legislators who touch Dunn County and over the last couple of weeks, and had some good conversations, I think, with that. We did that all via Zoom. It was an interesting experience, had a few technological glitches at the end. I'm just going to credit that to being tired of Zooming. But we did have good conversation. I think it was interesting because we partnered, as often we do when we go to the Capitol, but we partnered with surrounding counties or other counties that have share that legislative connection, which allowed for a variety of inputs, but that was good. And then today I waited out my turn to testify at the Joint Finance Committee meeting, which was here in Menominee at UW Stout. So what I would say about that is I believe tomorrow, what is today, the 22nd?
Yes.
Tomorrow is, I believe, the virtual one, and then they added a second virtual hearing because of the number of people who were interested in appearing virtually. If you have any time to devote to speaking to the issues that are at the heart of the county, I shared with Dave in an email and I shared with Diane earlier tonight. I believe that counties were very, very, very underrepresented at that Joint Finance Committee hearing today. Schools, universities, very well represented. Lots and lots of testimony about educational issues, not so much for the counties. And to the point of where I believe it was notable. Now, there were several Dunn County staff who did testify, and that was awesome, but there were no other county staff from even any of our surrounding counties, which was honestly disappointing because it is an opportunity, whether or not it makes a difference or not, it is an opportunity to be heard for your 2 minutes of fame about issues that are important. So if you have an opportunity, they also do take written testimony. So if you are interested in providing even a one paragraph email or whatever, I would encourage that.
We'll take you up on that, and maybe next year we can do some pop-up training so that people feel more comfortable participating. Thank you for all that work. Thank you to Chairman Bartlett. It's important.
That's all I've got.
Okay. Human Services Finances. Sarah, you're back on.
Can everyone see my screen with the snippet that was in the packet?
Yep.
Okay, I'll just start out. I usually just start with the projected. Right now, we are projecting to have $12,677,802 in expenses. That is made up of $7,725,267 in operating expenses and $4,952,536 in salary. Our projected budget, our projected revenue, excuse me, is $9,143,920. At this point, we look like projected we're going to use $3,533,882 of the county levy. So that looks like we'd get back $645,034 right now. Any questions on that?
Nothing so far this year that jumps out as an anomaly, or no?
No, nothing right now. It's really early. We only have roughly 2 months of expenses and maybe a month of revenue so far. So it's still very early to even see. And I know COVID's been keeping a lot of things down. There's still no travel. There's not a lot of trainings. People are doing those virtual. So that saves on hotels, mileage, all of that stuff.
Right. Supervisor Steen.
Yeah, Sarah, just so I understand this and I can go around and brag that we're going to get $45,000 back. Is that correct?
Yeah. $645,034 so far projected.
Don't spend it yet.
Careful. No.
No, I'm kidding, Sarah. Thank you very much for giving us as much of an up-to-date as you can give us. Thank you.
You're welcome. Any other questions?
No, we do always appreciate how well you keep us posted on this. Any other questions from the committee?
I just had one on the sheet that has the different items.
Are you talking about the vouchers paid?
Yeah. So
that's an action item we're moving to next. Thank you. Okay. All right, so we are moving. We have 3 action items on the agenda, unlike last month when we had lots. And the first one is the review of the March 2021 vouchers paid. Again, in your packet is a sheet with some explanations of. Chris has been helping us understand who these vendors are. So there were 3 more described for you this month. So $432,072 in vouchers paid this month. I need a motion to note review of the March 2021 vouchers paid. Supervisor Steen and Supervisor Cromley for the second. Now Supervisor Bjork, discussion.
Just had a question, going through it, I was surprised that I did not see more COVID expenses vouchers. And I see an individual with expenses, and I see T-Mobile with expenses, and I see University of Wisconsin non-payroll. Why would there just be one individual with COVID expenses?
So we only categorize a COVID expense as a COVID expense when we have a COVID relating funding source to cover it. So if we have things that we know are going to, so right now we are sitting on some what's called provider relief money, which actually came in last year. We carried forward into this year, which is a part of us being a Medicaid and Medicare provider delivery. We are tracking some expenses against that provider relief money because we'll report that to the federal government, but we only identify as a COVID expense things that we have a COVID funding source for. Everything else just ends up as a regular expense because it doesn't pay for us to track it to a separate pot of money if we're never going to have a separate pot of money to pay for it. It's more accurate to put it into the category of expenditure that it actually really is. And to be honest, we don't have a ton of COVID expenses in the Department of Human Services. We have, we capitalized last year on a number of grants, did extensive IT purchases and things that cover that got our staff equipped to be able to work remotely. We had some nominal costs for hand sanitizer and masks and, some of those odds and ends kinds of things. But actually, we don't have a ton of COVID expenses.
That answer your question, Supervisor Bjork?
Yeah, it does, except that when I keep turning the pages, I keep coming up with the same name. And, the first page, was about $2,000 to an individual for COVID expenses.
What is the name, Larry?
Christopher Hasselberg.
Hasselberg.
Yeah, Christopher. So that was one of the explanations that we did a few months ago. Christopher Hasselberg is a part owner in GoToIT, which is an IT services vendor. The county contracts with GoToIT to help in the procurement and distribution of IT equipment and the maintenance of some of that. And so when we purchase a laptop, when we purchase a printer, whatever, we purchase those through GoToIT. The way the county's financial system works, it makes you, Sarah can say this better than I can say this. It makes you identify your business name, you have an official name, and then you're doing business as.
Yes.
And so Christopher Hasselberg is the owner, and he does business as GoToIT.
Thank you. That helps.
Or monthly GoToIT. Sorry.
Go monthly IT.
Go monthly IT. Going somewhere with the IT department.
And hence the technology connection to COVID-19.
Right.
And so I understand what you're saying is there are also COVID expenses that are on part of our T-Mobile bill. And those are people that are specifically carrying a cell phone because they are working remotely, who we would not typically have had provided a cell phone to. And we have a handful of people that's the case for, who would not typically have a county issued cell phone, but because of COVID, they do. And so we're tracking that as a COVID expense.
Thank you very much. I'd have no trouble with Hasselberg, but if it had been T. Soprano for consulting, I'd have been worried.
Chairman Bartlett.
With Supervisors Bjork, questions that brought up something in my mind. Do we go out for bids on that IT equipment from that company?
Oh, you know what? Luann is here.
Luann, you had no idea that you were going to be asked this question.
Yeah, I can answer as best I can. We have an arrangement with them for these are for more I guess sporadic purchases by the departments. We have a website kind of similar. It's dunco.org. and departments can order standard items from there, but they're usually ordered in pretty small quantities. So when we do have a large quantity of purchases, for example, the 2021 replacement hardware, where we're replacing, over 100 workstations countywide, we either have to use state contract or RFP, all of those other purchasing things. That's more for the one or two things that the departments order sporadically throughout the year that aren't, they're more like new equipment that wasn't anticipated versus planned replacements. Does that answer?
Chairman Bartlett, you're muted.
Muted.
You're still muted.
So it sounds like that these purchases are small enough that we do not go out and bid them out.
Right. And it's more of a convenience for the departments. It was something that was set up several years ago with the IT leadership team, so that they could get things, more
Fast.
timely and last minute type things.
It would be similar to going off to purchase a laptop, say off of Amazon. The difference with Go Monthly IT is because that they set it up for us, they warranty it, they do all of that extra stuff that we don't get when we purchase a box that shows up to us in the mail.
And it meets our specifications to have consistent hardware throughout the county for our standard hardware. Yes.
Okay, thank you.
Thank you, Luann. Any additional discussion on the vouchers paid for March? If not, we have a motion and a second to note review. All in favor?
Aye.
Aye.
Any opposed? The vouchers are noted for March. Next action item is the 2020 annual report from the Veteran Services Office. This has been vetted by the Veterans Service Commission. I need a motion to approve. Supervisor Steen, is there a second?
I'll second.
Lonnie Barker, thank you, Ms. Barker. Is there any discussion, Greg? Is anything that you would like us to point out? This is an excellent report.
I would if I can. I think there's
Please.
a couple of things with just a lot of heavy emphasis on financial and budgetary items within the county. I think it's important. Two things that I'd like to emphasize. Number one, 2020 budget, again, just to identify that the veterans budget, small budget within the county. However, just want to point out, managed, there's nothing that was overexpended, come well within the guidance and the estimated budget that we had approved for fiscal year 2020. The second thing I'd like to emphasize is the federal veteran benefits impact, cash money that comes in, and just kind of hit a couple of those categories, not to keep everybody here too late. If you look at I think it's page 3,
Yes.
compensation and pension, and I have the comparable from 2019 to 2020. There's $12,416,000 that are brought into Dunn County, and that is cash payments to veterans or their surviving dependents with that pension. You can see there's an increase on there, and again, it's always a fluid number based upon lots of factors, but number one is the importance of getting that money. And so you hear throughout the year from our office reporting on some of those impacts, those direct successes with some of those families to bring that I call it that stabilizing money that comes in. So I'll never say that in the absence of what we do, there'd be major decreases in any of the funding or major increases for what we do, but I can tell you that we do everything we can to maximize every federal dollar for those veterans and dependents. The other thing that I'd like to identify is that medical care. Again, through the last couple administrations on the federal level, medical care is a key discussion and topic, on variety of levels, the cost of it, access of it. And so to really identify what the Veterans Administration does for Dunn County veterans. There's, as you look at that fourth line down, it has medical care / unique patients. I think it's important to identify how many veterans are enrolled in the VA healthcare system. And as you can see, 930, 2019, there was 968. Again, fluid numbers, but you can see there was over $10 million paid for their health care. I think those are very, very important numbers just to know that that's care that may not be burdened on other programs, such as any type of a Medicaid program, Badger Care, for example. That's even though they're both federal programs, but I think that's definitely noteworthy. The other thing is as far as money spent for medical care in Dunn County, the Mission Act in 2018 with the VA was approved at the last administration, and that allowed local health care access for veterans. So we now have veterans that are able to get authorizations to get care at Mayo Health System, Marshfield, Prevea. So that's money coming into the community again. So I think that's a definitely noteworthy items. And I won't belabor any of the other items within the report. Those impact statements, you guys have seen them throughout the year. I think I want to be able to put a face to the individuals that are impacted by the work that we do. And that's my emphasis to do that through those impact statements. So I'll entertain any questions. I just wanted to highlight some of those financial items, since that's the big item, big hot topic.
$24 million coming into the county is not insignificant.
No.
Supervisor Steen.
Yes, Chairman Morehouse, and this is not a question, but I agree wholeheartedly that not only does the Veteran Service Officer provide human services or human contact with the people they serve, they are a huge economic impact to our county. One of the few departments that generates a lot of money coming into the county, and I think it behooves us as a Human Services Committee and the Veteran Service Officer to bring this up every year, because I think sometimes this is overlooked, and I appreciate Greg bringing that up, and I wholeheartedly support making it more public.
Absolutely. Absolutely. And I will inject my personal opinion. Thank you for sharing the stories and the data. This is an excellent report. Other questions for Greg before we call the question? All in favor of approving the 2020 annual report from the Veteran Service Office signify by saying aye.
Aye.
Any opposed? Approved. And the last item, which Katie mentioned earlier, is a budget adjustment for 2021 for the health department. Katie, I need a motion. Sorry.
I so move.
Supervisor Steen, is there a second? Ms. Barker. Thank you, Ms. Barker. KT, now, do you want to touch on this briefly?
Sure. So there are two things in the budget adjustment, and I'm going off of memory. There was, so the Community Foundation actually has supported our Health Done Right coalition for, I think this is our fourth out of 5 years, with $10,000 to support backbone support. And so we use that to offset some of the cost of our public health educator. We received it last year. We've received it for 3 years now. It didn't get tucked into the budget. It was just an oversight. There was other Community Foundation dollars that did make it in, but this did not. So we just need to make up for that by getting that properly approved by the governing board. And then the other was just out of the blue, wonderful donation of unexpected funds.
Yeah, $10,100. Any further questions or discussion? If not, all in favor of the budget adjustment signify by saying aye.
Aye.
Any opposed? Any opposed? Approved. We have nothing to forward on to the county board. Any announcements from anyone? Supervisor Bjork?
I believe today is Earth Day.
It is indeed.
Back in 1970, I believe, and I was a student at River Falls, and it was a big deal in the ag school. And I think it's probably become more political than it needs to be. But could anyone remind me, was Proxmire and Nelson both initial sponsors or not?
Gaylord Nelson.
Yeah, Gaylord.
Thank you. Well, anyway, happy Earth Day.
And happy Earth Day, and it certainly has significant health consequences. Before we adjourn, I have just been notified today that Sarah Schaefer is leaving the Health and Human Services Board. She's been a valued member since 2018, and we thank you very, very much for your service on the committee. We appreciate the work that you've done, and we will miss you. Everybody, thank you, Sarah.
Thank you all.
Thank you.
I've enjoyed my time.
Good, I'm glad. And you've been a big contributor to our work, so thank you very much.
I have one more. I don't want to embarrass you, KT, but I do want to note KT has worked so incredibly hard, beyond reason, incredibly hard, and you all have been very supportive of her and of that. But KT is going to take a week off next week.
Really?
We are so happy.
That's wonderful.
For the first time in a year and a half.
Well deserved.
Very much deserved.
And trust us, this includes weekends and nights and long, endless hours. So this is a richly deserved week off.
No checking email.
Really. No emails. Do not check your phone. I'm sure you
Okay,
have to.
I can give advice. I don't follow it, but I'm giving you advice. No checking email.
So I am going to go spend a week doing little old lady things with my 91-year-old grandmother. I'm actually looking forward to having some away time so I can get a couple reports off my desk. So there will be some work, but it will be from a very different location. Not at all sunny. It will be in Ohio.
Wow. Good luck to you.
Yeah. Happy trails. All right. If there is nothing further, thank you all. We are adjourned without any objection. See you on May 27th. Bye-bye.
Everybody
Night, everyone.